The normal blood pressure is 120/80. Closest blood pressure to that number is the healthiest. So it's so important to control it because one, it's a silent, oftentimes it doesn't cause much of symptoms unless it's severely elevated. Number two, it's common. And number three, we actually know very well how to treat it. My name is Sadeer Al-Kindi. I'm a cardiologist. I specialize in prevention of cardiovascular disease and imaging of cardiovascular disease. The top number of blood pressure is called the systolic blood pressure. The bottom number of the blood pressure is called diastolic blood pressure. We measure both of these in millimeter of mercury, which is a unit of blood pressure quantification. The upper number, systolic, is basically the tone or the pressure of the blood as the heart is contracting. When the heart is contracting, it adds more pressure to the baseline tone or the baseline pressure of the blood pressure. Even when the heart is relaxing, there is still some tone or blood pressure that is demonstrated by the diastolic blood pressure. Both blood pressures, as they increase the risk of heart disease and other problems, vascular disease, strokes. We worry about both almost equally. Sometimes there is what we call isolated systolic blood pressure or hypertension. There is isolated diastolic, which are a little bit more rare. But in general, both numbers go in the right direction. I would say both of them are equally important when treating high blood pressure. In general, both numbers go in the same direction. When you have an elevated systolic or upper number, there's usually elevated lower number as well. But sometimes in rare situations, we have isolated elevated systolic, what we call it systolic hypertension. There are sometimes isolated diastolic blood pressure. So we often report both, look at both, and treat both. We take things individualized because there are some risks associated with increased bottom number, even if the top number is not elevated. There are things that can acutely happen with elevated blood pressure, including that stress on the brain vessels and can lead to bleeding inside the brain, what we call intracerebral hemorrhage. And there are things that can happen more chronically. So the things that happen acutely can impact the blood vessels, it can impact the heart, it causes some heart damage, it can impact the kidney, it causes kidney damage, and there are other additional damages that can happen inside the brain, inside the valves of the heart, and so on and so forth. Chronically, elevated blood pressure can actually increase the risk of a variety of different cardiovascular diseases, including congestive heart failure, including myocardial infarction, which is a heart attack, including stroke, the stroke that is caused by clots, but also the one that is caused by bleeding. Anything above 130/90 is a sign of increased blood pressure that we start to think about treatment in specific individuals. Anything above 140 systolic, the upper number, we start to think about additional treatments or even more treatment for individuals who may not have been treated before.